Great. Well, I'm sure people are still filing in, but we'll go ahead and get started with just some introductions and talk a little bit about what we're going to talk about. My name is Amy Romano. This session is Choices in Childbirth, Co-Designing a Digital Resource Grounded in Equity, Equity and Birth Justice to Foster Informed Decision-Making, Individualized Care Planning, and Strong Support Systems. We're really excited to be here and part of the summit today. These are our speakers. Maybe each of us can just say a quick hi and share a little bit about our background and role in this project. LaShonda, you want to go ahead?
Sure. Hi, everyone. I'm LaShonda Dandridge, an IBCLC, a board certified lactation consultant. I do lactation consulting in the community and also some work all around. I'm with Chocolate Milk Cafe, which is a peer support group as well. And I am here in New York City.
Great, Lorenza, go ahead.
Hello, everybody. My name is Lorenza Holt. I hang out at the Greater Boston area. I am a birth doula, a childbirth educator, a trainer of doulas with DONA International, and also a Spinning Babies approved birth doula trainer. And I'm delighted to be here. Thank you.
Great. And like I said, I'm Amy Romano. I have an organization called Primary Maternity Care, and I worked on this project with Every Mother Counts in the role of developing and implementing the learning agenda and working closely on production of the materials that we'll be looking at today.
Hi, everybody. I'm Nan Strauss. I'm the Managing Director of Policy, Advocacy, and Grantmaking at Every Mother Counts. And we were the organization that brought together, we got funding for this project, and we brought together this phenomenal team of experts that you'll hear more about as we move forward. And we really used our background both in storytelling and also in maternal health to lead this project. And I was fortunate to inherit it and walk it through the many stages, and we're still working on it as we speak moving forward. So we'll get to walk you through that journey with us today. Thanks.
So in this talk, we're going to be just giving you an overview of what Choices in Childbirth is. I'm sure some of you have come across it, but it'll be new to many of you. So we'll take a peek at what this educational learning program is. And then we're really going to spend most of the time talking about the process that we use, which was very participatory, had a lot of different stakeholders, and was very much grounded in community input. So we're going to talk a little bit about sort of how those different parts and pieces came together in the process. And then we're going to reflect a little bit on that process, and in particular on questions of how we really kept coming back to keeping equity and Black maternal health at the center of this work. So these were the learning objectives for the presentation. So I just included them here, but we'll talk about why it's important to have the community input and lots of different stakeholders involved in a project like this. We'll talk about a bunch of different ways. So we hopefully you'll remember at least 3 of gathering feedback from different stakeholders. And then we can talk a little bit, and we can go into more of this in the question and answer if you want, but just ways that we can get this resources embedded into childbirth education, prenatal care, and some of the work that we're doing on that, but also some of what this community can do with that, because this, I'll say it now and hopefully we'll remind people throughout it, this is a completely free resource and it's available to everybody in English and Spanish currently, and that will remain true. Nan, I'll pass it to you just to kind of give this overview and background, and then we're going to show a video after this that we'll watch together that takes, I think, about 6 or 7 minutes.
Thanks so much. So this project was really a huge partnership, and it was begun when we got pretty much a cold call from folks at CVS Health and Aetna, who were interested in really exploring the best ways to share some of the wisdom that we know comes from doula support and through the midwifery model of care they wanted that to be shared more widely, because in recognition of the fact that very often many people around the US don't have access either to doula support or to the midwifery model of care, both of which are evidence-based models of care leading to excellent outcomes and excellent experiences of care. So they were interested in seeing what they could do to improve people's access, not to those services in this project, but to the wisdom, some of the strategies and approaches of care, and then also to share information about those models to make sure that where possible, people could pursue obtaining a doula, whether through private pay or also through community-based organizations that often provide support free of charge, and also so that they knew what more of the options were in people's communities, because very often, even if there is a birth center or midwives providing care in hospitals or doula support, very often people simply don't know about those options. So step one was make sure people know that these options exist. Step two is give them some tools to access and pursue those options if they seem right to them, or to pursue a positive experience either with a different physician or the physician they've been seeing, give them communications tools. And then also that piece of really providing people with those tools to walk through their pregnancy, their birth, the postpartum period, with the knowledge they have and the confidence to take an active part in decision making. So when they contacted us, we knew that this was going to require a lot of hands on deck, and that no one person or one sector of the healthcare, public health, and support services system could walk people through this journey on their own. So we started by really gathering together the voices that we knew from working in this space for many years could provide that expertise, and making sure that it was coming from, again, a multi-stakeholder perspective, both people working in and serving different communities and people working in and serving people from different workforces. So we started to gather together not just Amy Romano to lead us through creating the learning agenda, turning that into this series, but also the people's voices who would really serve to identify what the core components would be for that learning agenda, and then serve as, in many cases, the voices that you see in the video series. So I think now would be a great time to share the video.
So I think actually, why don't we?
Sorry, did I skip a slide?
I think I set you up to skip a slide, but
yeah.
Why don't you go ahead and watch the video, and then I'll reshare what we were just looking at and kind of fill out what the rest of the program entails. Catherine, can you share that now? And as we click on it, I'll just say this is one of 10 of our videos.
The reason why I wanted us to meet up together today is to be able to have an opportunity to really like connect, get to know one another, and for us to start to do some work here. I always start off with like, what is your vision for your birthing experience? And people will oftentimes be like, well, what do you mean, what is my vision? Like, aren't we going to the hospital, right? And I'd be like, no, but what do you want for yourself?
Because people don't think about I should have a good birthing experience. Right. They just know I'm going to have this baby. Like they don't think about how I should experience having my baby.
Right.
Like what the outcome should look like for me to give birth to my child.
I've probably attended, thousands of births at this point, but I don't think anything could have prepared me for being in that position myself, and not just attending births, but I've actually led quality initiatives and thought about how we measure quality and how we show up, the same way every time for every birth But when I myself was pregnant and moving through this experience for the first time, wasn't so much thinking about the rare, scary events. It was like, what do I eat? How much water am I supposed to be drinking? When was the last time I felt this baby move, and is that okay? Like, I needed someone to just talk to about all of the normal stuff. And I don't think that I really understood that embodied feeling until I was going through the day-to-day of it myself.
We have to accept that fear is part of the process instead of like trying to push it out of the room or anesthetize it or numb it, that it actually serves a physiologic role in the process that you need. Even like as parents, you need a little bit of fear to keep everybody safe almost, or to know what the tension is in the room is. And I do think that sometimes we forget that fear is a part of the human experience, and particularly plays a role in labor and birth.
It's the difference between sitting and preparing against maternal mortality or morbidities that we know about, and being prepared for a level of vitality. So many women that I speak to or that I support really go into birth thinking that it's like another thing that's going to be checked off of a list, or it's going to be a very cold, sterile experience that really just needs to get over with and done, rather than something to be fully present for and something to ask exciting questions about along the way.
People need to know that they're not alone, right? And sometimes like the birthing experience can seem lonely, and it could feel extremely difficult, right? But this is where we're using those affirmations of like reminding them of their power, right? Reminding them that they have this strength. What's one of the things that you use to remind yourself when you feel like, whoo, this is getting rough?
Just repeating, whether that's like writing or saying out loud, you got this. You've done so much before you got into this point. You can get to that point. That reminder to yourself is like, yeah, I'm really all I need.
Right? Child, I love a good sticky note. Right? So like a sticky note, dry erase marker, you can put something on a mirror, right? To remind yourself like, I am powerful, I am strong, like I am capable, I am here, I am doing this.
A lot of times in African American culture, it's a big deal for us because of the maternal mortality rate. We are 3 to 4 times more likely to die, and so they want to make sure that they are supported during their childbirth.
Despite all my reading and tutorials, the first time I was still scared because it was just me and my husband there, you know, us against the world, so to speak. And like I said, that you know, we didn't have the extra support, so I was scared. But that second time, I wasn't.
You were able to attach yourself to something that you created, to a dream that you created, and you knew that you were going to bring it about. And you also knew that everybody on your team, your midwife, your doula, your husband, was 100% down to carry that out. And I think that's what allows women to feel that fearlessness, you know? There's nothing holding me back. Yeah. There is nothing that's going to stop me. Actually, there are people who are going to help me get there because they believe in what I'm doing. They believe it's safe, they believe it's right, and they want me to have that kind of birth.
I want you to be centered in joy. I want you to be centered in happiness. I want you to be centered in love. And I want you to know that people genuinely care about you. So I'm going to do that by getting to know about you. Tell me about you. Hope is really built on who you choose to have centered in that particular experience. You know, hope is, you know, the joy that you want to create around your birthing experience. Hope is the love that you want to see and the vision that you have for yourself. And look beyond just the present. You know, look into the future. Like, what does your future look like? And how is it built on that?
Imagine your baby nice and cozy and warm, curled up inside of you, just waiting to meet you. And I want you to imagine that we are breathing in all of the good things, all that is peaceful, all that is calming, all that is helpful to you. And we're going to breathe out anything that doesn't serve us. For we know that you are the expert on your body and that you are doing a great work.
Thanks, Catherine. I'll share again. I love that one. That was lovely. All right. I think I'm gonna make sure I'm sharing the right slide. Sorry. So there was a question. I'm not sure how to respond to questions. It looks like our responses are just going to the panelists, but there was a question in the chat about, are these resources available publicly? And they are. You'll see this website, everymothercounts/choices in childbirth, on most of the slides, so you can mark that. But this is the website. I'll show you a little bit more when we jump back into the slides, kind of what all is here. But I also just wanted to show it to you since it's up currently. Okay, let me get back into view mode. So as I mentioned, what we just watched was one of 10 chapter videos. So each has a similar style, narrative driven video that's kind of an anchor that also comes with a bunch of related planning tools. And so the website houses each of the 10 chapters with the supplemental materials. We'll look at a couple of those coming up, but those include downloadable worksheets to help people plan their birth, plan their postpartum, plan the support they're going to need, reflect on their priorities. So we'll see some of that. We have a number of articles, including articles around selecting your care provider, articles around how to find a doula for low cost or free. We also had so much beautiful footage that in addition to the 10 sort of fuller length videos, like the ones we just saw, we made a series of shorts, and those include sort of short 1 to 2 minute videos that are kind of more instructional. So you saw in the last one, it was more meant to kind of get you into a feeling or lead to some curiosity or some thinking. The shorts are more like how to use a sitz bath, like how do you, what's the difference between a midwife and a doula? So we just sourced from the footage that we got from our amazing days. We went to Chicago, New York, New Jersey, and Oregon. So we just had a lot of great material. We're able to make some video shorts. And then we also curated resource lists on a number of different topics. And then integrated into the Choices in Childbirth website is JustBirthSpace. Actually, LaShonda, do you want to tell us a little bit about JustBirthSpace? Because you're a JustBirthSpace connector.
Sure. Hopefully my internet cooperates with us.
I can hear you.
Can you hear me?
Yeah.
Okay, perfect. So JustBirthSpace is another free resource that consists of what are called the connectors. So as I mentioned, I'm a lactation consultant on there. That has 3 kind of tiers where there's a text connect. So individuals can just text information and they're connected with a connector who can send them information, whether it's prenatal, while you're pregnant, postpartum, lactation, whatever it is. Then there is an option for a We Connect, which is a one-to-one, where the connector can do a video meeting as such, based on what the information the client needs. And then there is Community Connect, which are different classes and support groups. So we have, I do a newborn care class every month. I do lactation support groups. There's prenatal support groups. There's postpartum support groups. There are Nan, you can probably help me out on what other, there are so many.
Queer LGBT,
The queer LGBT groups. There's the healing support group for birth trauma. So there are a lot of groups, and we started, again, I said I'm in New York, and we started here, but every day I log on, I'm meeting people from all over. So it is definitely growing. But again, another free resource that is supplemental to, you know, a lot of people just hear about the information, and, you know, we hear about doulas and all this stuff, but in a lot of spaces around the country, there's not that community resources that people have easy access to. So JustBirthSpace, it came out of the pandemic, but really and truly it's something that it was always needed, because there are a lot of pockets around the US that doesn't have that easy access to those resources.
Great, thanks. And there was a question in the Q&A. So yeah, that's all free as well. Okay, this is where we were going to watch the video. Whoops. Yeah. Pass by that. All right, here we go. So
the question, I'm just going to hop in for 1 sec. The question was, is it free and can people log in from anywhere?
Oh, okay.
And I will just add that we do have very specific local resources that are specific to New York and New Jersey. And the idea has always been that the connectors can make really a much more robust set of referrals, do warmer handoffs, and really connect people to other services in the local area and have a much greater depth of knowledge. On the other hand, of course, anyone can text in from anywhere, and a large percentage of the questions are questions that would be relevant to people across the country. I'll just answer one more question because it's coming up now on JustBirthSpace, and then we'll turn back around to focus more on the choices in childbirth, and I'll turn it over. The financial model for sustaining the JustBirthSpace platform right now is Every Mother Counts is underwriting it, but we are very actively working on expanding that so that we have additional funding sources, and we're actively looking into expanding more in a more robust way into other areas as well. And that we might come back around to that at the end if we have time. But back to you on choices in childbirth. Thanks.
Thanks. So these are some of the supplemental resources, and these are in fact the set of resources that come up after you watch the video that we watch. So we really, and we'll get into this more when we talk about the process, we wanted to people to do something or take a next step after the videos, and a lot of our inquiry during the development phase was like, what exactly do we want them to do and what does that look like? So for navigating hope and fear, we connected them to our support planning worksheets. So we have these both for partners as well as birthing people, and for each phase, pregnancy, birth, and beyond, and postpartum. We created these lovely kind of affirmations you saw in the video. Chanel and the other doulas talking about just affirmations, and so we made these and also gave people kind of a little thing to make their own. And then this type of providers is from one of the articles around choosing a provider. So this kind of lays out both for the different types of providers, midwife, family doctor, OBGYN, or MFM, kind of what their focus is. They can be in charge or lead the care team if you meet these kinds of criteria, and they can be part of the care team, because we really wanted to help people understand, like, it's not one versus the other. Really, the best model is for people to access the right combination of providers based on their needs and preferences, which can change. So these are some of the supplemental resources that are, viewable in the site. I'll just go through a couple of others that show up and are related to some of the other videos. These are checklists to clarify people's values and preferences for prenatal care and for birth. So checking off things, whether like this is a top priority for me, or like, actually, I don't really care so much about this, or you know what, I need to learn more. That final column, like, I actually need more information before I can decide if that's important to me. So just a structured way to go through that. And each of these is more than 1 page long, but these are the first page. A birth plan that takes some of that, like some of the work from the values clarification, and builds on it to actually build out a birth plan for folks. I loved this little postpartum love letter to your body, which is just like a Mad Libs kind of fill in the blank to help people just give love back to their body and find gratitude even if the birth wasn't what they envisioned. So those are some of the resources. We're going to shift gears now and talk a little bit more about the process and spend most of the rest of the talk talking about it. So the overall project was organized by like pre-production, meaning the stuff that we were doing before we went out to New Jersey and Oregon and wherever and filmed. So all the planning and coming up with like, what are we up to? What are we trying to get out of video production? And then the production itself, which took a couple of months because we were filming in different locations and also dealing with COVID and other things that were throwing off our travel. And then post-production and taking the raw footage and then building out also the website and those supplemental resources. So we'll talk a little bit about the different ways that we engaged multi-stakeholder input. And we really kind of built over time, starting from a working group, which Nan and Lorenzo will talk about in a moment, which happened at the same time as kind of just reviewing the literature and understanding where the gaps were and talking to the community partners that Every Mother Counts has been cultivating for many years to just, get a sense of what would be most helpful with this incredible opportunity to create these resources. And then production, working with the working group, advisory group, and those same community partners, as well as some new ones that were featured in the films, to produce the videos, to get the stories, to know who we needed to talk to get those stories, to ask the right questions, to make people feel safe sharing all of this. And then to get it right, and make sure we had the right diversity and representation and so on. And then post-production is really where, all of this came together, and there was a lot of need for input as we kind of took this massive body of work and shaped it into resources that could help guide people and improve outcomes, hopefully. Nan, you want to talk a little bit about the working group, and Lorenza, you were a member of that, and I'll
Sure.
go on mute.
Yeah, thanks. So from the beginning, we knew that, as I was saying before, we really had to bring in a lot of experts who were really experts, not just because they were doing research, but they were doing the work on the ground and had been engaged in this for long enough to see a very long trajectory of different approaches coming and going, different strategies for educating and learning. So we engaged a working group of 7 thought leaders and experts who are not just doulas and midwives, but people who educate doulas and midwives and experts in childbirth education who really shape the content and the learning agenda throughout the period of many months from April of 2021 all the way through the end of last year. We brought this group together multiple times to really co-create the learning agenda and design this series together, focusing on building a sense of trust with the audience, identifying the topics that address their multifaceted needs and experiences, focusing specifically on pregnant people of color, and discussing overarching concepts. So we started by asking what some of the key topics and issues were that they felt like were essential to be covered, and then talked about what are the strategies that people could be using on their own to both get the information that they needed and get to where they needed to go. And then also asking as well, what existing resources are there that we should either be referring to, incorporating, including in our library of resources, and using to enrich the content as we were pulling everything together and organizing it. And then as the resources were culled, organized, and then as the films were shot and edited, we reconvened for feedback sessions, both on the early stage videos and supplemental materials, and then at the end to to discuss opportunities for sharing these resources more widely. Lorenza, did you want to talk about the experience during the working group that you had?
Sure, thank you. Thank you for inviting me to participate in this whole project. It was a wonderful experience. As a Latina, as a childbirth educator, trainer of doulas, I really felt that it was the materials available for our communities of color to really make informed choices and informed decisions in ways that are grounded in truth, for what is right for our communities was really, we feel, was really lacking. And so to have an opportunity through this project to really develop materials that could be used by our very diverse communities was a great opportunity, but there was also some skepticism of, can we really pull this off? And so to bring this group of, to have these conversations where we were able to really explore what are the topics that we want to share with our communities to help them make informed choices around birth, parenting, postpartum experience, the whole perinatal experience was very important to me. And I think the conversations were grounded on honesty, on truth. There was a lot of pushback, making sure that we were going to get it right, that we really were going to, that the voices that we wanted to come across actually came across, that the information that we were going to share was actually valuable information, that we were not going to set people up to fail in wanting something that they could actually not access. So there was just a lot of really rich conversation and discussion that I think led to this really beautiful product that we ended up with. So those are my initial thoughts. I know I could keep going, but time is of the essence, so keep going.
And you were one of those people who really, I think, held our feet to the fire in a couple of ways that were very valuable. And for one thing, I know it was really important to you that if people had questions, they could have those questions answered, and that people not be left just saying, well, this is great that this exists, but I don't know where to find it. And that was one of the impetuses for us to incorporate JustBirthSpace into the Choices in Childbirth set of resources. And it was very valuable to hear what educators and care and service providers had found over the years to be real stumbling blocks and hurdles. And even when there were tough questions that we really didn't know how we were going to solve them, it made us keep thinking and really improved the end result. Thanks.
Yes, the resources, I think also, like just how do we create resources that are not just available to people in urban settings that have more resources, but what do we do with people who are in more rural areas or areas where resources may be less available? And so how to create a way for people to get answers to their questions, but also to really help people know empower people to really explore their options that would be real within their own communities, to ask beyond what was immediately offered to them and really dig deeper into understanding their communities and their choices and their resources, and to push further for what people wanted, to create resources to support that process.
Nice. Nan, this is you too. You want to talk a little bit about how the advisory committee came together and the role they played? And LaShonda is one
Sure.
of our members, so we can hear from LaShonda too.
Yeah, I would say similarly, we convened the advisory committee to even broaden out the circle further and to ensure that as the working group was really there as the core co-implementing team, but then, or co-development team, but then as we got further along and the videos were being created and edited, and Amy was pulling in a lot of different resources, we were able to get an even wider and more diverse group of people together to provide feedback on those more finalized resources, to refine the content, improve the accessibility, ensure that things were landing right, that things sounded right, that the content that was pulled and edited was culturally appropriate, culturally sensitive, not striking false notes on any fronts, and that everything we had hoped to get in there was actually coming across in those videos. So LaShonda, I think you're even better placed to speak to this.
Yeah, so much like what Lorenza touched on with being part of the working committee, as when Nan reached out to me as the advisory committee, you know, there was a little like hesitation, especially when you hear like big names like CBS and stuff and wanting to, you know, it's like, what is this really going to be? But hearing about the process more, knowing Nan, you know, we worked together for many years before that, hearing who was a part of that and that it was truly community based, you know, some of those walls let down a little bit. And then getting in the space and seeing who else was there. And I, you know, like everyone mentioned, it wasn't just New York, but New Jersey and Chicago and stuff. And I had seen these people in other spaces. And so that made it a little bit easier to be in the space and really be able to talk freely and have that pushback and have really productive conversations, because we really felt that everyone had this collective vision of what we needed to happen, the end product, and really having something that was quality for the community. So I think that was really valuable in being able to sit there and, you know, because like one of my fears, and I think other people had this too, is like, again, when you hear about that big name, and it's like, yes, they would have so much reach into communities that we don't have the reach into, right? But there's always that hesitation of like, is this, you know, just the trend, and is it going to be a soundbite, and now there's this company just using this to, you know, hop on the trend. So what is that space to make it really quality versus just it being just this trendy thing that this big name company wanted to do? And I think it came out beautifully. And again, because we were able to sit in that space with trusted people that we had worked with, and it was truly, truly community focused.
Great, thanks. So this is kind of some of how the learning and activation framework came about. So I came into this project pretty early on, but the working group already existed and had done some of this groundwork to really think about like, what gaps are we trying to fill, what topics are you know, so are the most important, and so on. And so we kind of broke that down into like, when are we trying to reach people? What are the times when people are on the steep part of the learning curve where we can, you know, set them on a right path? So trying to find people preconception, or at their very first visit when they're, you know, or when they first find out they're pregnant, or when they first, you know, develop a complication or something that requires them to, you know, think about the care plan differently. And then obviously as birth approaches, postpartum, and so on. So we kind of mapped out all of the possible topics against these moments where we could reach people potentially with something that could influence an outcome or behavior. And then we also made a pretty early decision to focus on what I refer to as meta decisions. These are the, you know, we didn't think with a program like this, we were going to be able to meet people at the, you know, the decision of whether to or not to have a C-section, or whether or not to say yes to an induction or an epidural or whatever the case may be. But we could help people find their way toward care models and sort of planning resources that could sort of help them upstream to be in a better position for those decisions downstream. So if we can sort people into a midwifery care model who are appropriate for and interested in that, then, you know, that in and of itself would take, would, you know, have an impact likely on some of the downstream decisions and interventions and outcomes. Same with if we can really get people to focus on making a support plan and assessing their support resources or their self-care, you know, plan and so on, and sort of help people build those up. So that's what we focused on. And then what we worked a lot with the working group and the advisory group and in the focus groups, which we'll get to next, is really for the program overall and for each individual chapter to have learning and activation goals. So we asked the question kind of over and over, what do we want people to learn? So what facts or skills are we trying to impart? What insights do you want them to glean from this? How do we want them to feel? What emotions or experiences are we hoping to foster? That last video that we watched was big around like, how are we increasing people's fear? You know, and that was one of the things that came out of like, oh, actually, we kind of got the balance a little wrong. And so as we iterated on that episode, it became more hopeful, I guess I would say. And then what do we want them to do next? So what specifically do we want them to do? Write a birth plan, ask their provider this question, whatever. So that's kind of how we thought about the videos, and then also what made sense for those supplemental resources and the overall user experience of interacting with these resources. These are just some of the community partners that we wanted to name, who we worked with closely, and who are featured in the videos. So we saw actually people from all of these, I think, in the last video. It's really great to be able to, like LaShonda said, these people in all these different parts of the country and really bring them together in this project, and also even in some of the episodes themselves. And then we also conducted formal focus groups. So Mathematica was our evaluation partner on this project, and they developed 4 focus groups for us, developed and ran and analyzed the results from 4 focus groups. So we had one that was comprised of Black birthing people, one with bilingual Spanish English, and 2 with just a diverse group. And we had them look at they gave feedback on 2, and I think one of the things they watched 3 draft episodes, and we asked them polling questions before and after, and then had focus group discussion, and had surveys and stuff. So we have both some like structured and unstructured data. And really the focus of this was to see, like, do they like them? Are they receptive to the messages? Would they, you know, watch another video from the same resource, from the same series? Would they recommend it to a friend? Questions like that. We also were looking for their feedback on the format and the content, and less like kind of storytelling vibe and stuff like that. And also we were able to measure through those pre and post surveys some impact on knowledge and activation, and sort of get a sense of whether we were having an impact there. So that was a huge part of just like, yeah, finalizing the content of these. And then I can't remember, Nan, if you or I were going to do this slide. I'll go ahead and do it, and then I'll pitch it to you if you want to add anything. And then I think from here we go into discussion. But we've heard a little bit about some of this already from the discussion we've had. But the big challenge, and what all of these sort of components, the working group, the advisory committee, the focus groups, the community partnerships, and just our collaborative work together, bringing lots of perspectives to the table. Our focus was on you know, keeping to the truth, as Lorenza said, and like how can we stay true to what people really, what we know is going to resonate, and so on. And so a number of tensions kind of came to the surface pretty frequently that we grappled with and tried to find balance around. So one, I think we've heard a little bit about each of these, but the importance of creating trust, ensuring people feel seen before diving into clinical topics. So that's part of why we sort of backed up to the meta decisions rather than like, here, we're going to tell you, you know, whether, you know, how to choose to have a C-section or not. Acknowledging stress and valid fears around childbirth without contributing to that. focusing on narrative versus didactic structure and trying to understand, what was going to be effective for different kinds of messages, and making sure that we actually get to some concrete and actionable messages and not just kind of stories. And then being honest, this was probably the biggest one, being honest that, these choices are not always out there. There's systemic racism that people are up against. There's, negative experiences and poor quality of care is kind of rampant in our system. And so to kind of have these beautiful videos with a nice soundtrack behind them and people having very positive experiences can kind of like sell a bill of goods that doesn't actually exist. And so we, in a lot of communities. And so it was really around like finding a way into those conversations and acknowledging that while also giving people real like tactical ways that they can still navigate the system even while it's broken. And then, centering BIPOC experts and birthing people across all the videos while making them, potentially valuable to general audiences. So we really, that's something we came back to of like, is this for everyone or is this for Black birthing people? And we decided it's, the both and, but really leaned into centering Black birthing people and Black providers. I think you saw that in the Navigating Hope and Fear. We also chose to have certain episodes really be specifically for Black people, as well as other episodes that are specifically for Spanish speaking people and that were filmed in Spanish. And then the whole site is translated in both English and Spanish. So the 2 Spanish videos are available in English and the Spanish resources are available in English and vice versa. Just quickly,
I think we should move on to the dissemination. I guess I'll just say one thing, which is that we really did have a fantastic partner in Joanne Armstrong, the physician who was the head of women's health at CVS Health. And actually, she may have been at the time at Aetna, but the point is they really trusted us and we in turn trusted our experts that we'd been working with for many years. And, it was not always easy. We got a lot of pushback, as LaShonda and Lorenza said, and rightly so. Everyone wanted this to be really good and really honest, truthful, and serve as many people as it could, and serve people in the communities who are really facing significant health disparities in maternal health, which I'm sure you're all well aware of. So very particularly, it's been said over and over again, really reaching out to communities of color, particularly Black women and Spanish-speaking pregnant people. And CVS and Aetna really did trust us. And I think a lot of that is due to the leadership that they had there. And Joanne Armstrong was really wonderful at holding them to their commitment.
Yeah, I agree. So just briefly on our dissemination so far, the site launched at the very end of January 2022. So it was live since February, and we did some social media and paid ads. Aetna sent it to the members that they had contact information for, who they knew were pregnant, through newsletters, SMS, and mailers. So this on the bottom here is one of their mailers. And you can see it's just very inviting. One of the things I was pretty proud of is that we were able to change their standard language from ask your doctor to ask your doctor or midwife through just, collaborating with them on this outreach. And then ongoing outreach to implementation partners. So what we're doing today and others. So this is kind of the last slide. We have more about sort of where we're going from here. If you want to put questions into the Q&A or the chat, we can add those, but we just kind of wanted to have a conversation here. I think we actually kind of talked about the first question already. So we talked about some of these. Maybe we'll start with a third question and we can speak to any of them as we go, but do any of you have like a moment or an experience or something that happened during the process that stands out to you?
LaShonda, do you want to go or? So this question's to me, right? To us in the panel.
Yeah, right.
I mean, for me, it was one of the ones that really stood out was we can't do it all. And so the conversations about, can this include the voices for Native American people giving birth who are living in a reservation who may not have those resources? To really have those conversations, to me, that was very profound. Into just sort of thinking, how do we reach out to that community? How do we do better? Because what the resources that may be available to those individuals might be very different than what might be available to somebody in New York or Boston or in another part of the US. So, but we had those conversations, and I think that was really important, to be able to hone down what is it that we want to accomplish with this particular project, and be realistic and confine it in a way so that it could maximize the benefit to as many as possible and still have as inclusive a language and be inviting to all people. So that was one for me that still stood out. Others were just in the development of resources and the importance of that, of not just having the videos, but really creating additional resources that people could use to help them further expand their choices or support their decision-making process.
Yeah, that's a good suggestion. I think I remember that we were, we had been saying stuff like, oh, we're centering BIPOC experiences, et cetera. And somebody kind of called the question, is like, are we really like, are Indigenous people visible in this program? And we're like, oh, I guess, good. Actually, ultimately, the Spanish-speaking languages do have 2 Indigenous midwives who work with Indigenous populations, but it's not, like the kinds of issues that you were talking about, Lorenza, we weren't, adequately addressing with this. So just to be able to name that we're centering Black and Spanish-speaking experiences in this, and maybe there will be another grant someday where it can, we can add on more populations. I think we got, similar kind of wanting to be inclusive of gender and sexuality, and I think we reached like a level of inclusivity there, but it's not a program that directly speaks to those experiences. And so I think, yeah, gaining clarity was helpful. Let's see what some of these questions are.
Here's a question of, how do you suggest childbirth educators and doulas incorporate the site with their existing course, curriculum, or content? I would say become very familiar with this resource and use it. Like, that's what this is about. Use it, integrate it, show it in your classes, share it with your clients, engage them in these conversations, use these videos to say, what do you think about that? There's so much more that we could talk about. Like, it is such an amazing and beautiful resource. And use it, look at it, like, go with it, run with it is what I would say to that question. Any other questions do people have?
We'll see if anything pops up in the Q&A. I'll just address this last bullet here, what's next for choices in childbirth. We're really excited that CVS Health, through their foundation, has continued to want to support this project. And so we've just been awarded a 2-year implementation and evaluation grant that is going to focus on integrating these resources into different prenatal care models, and developing blueprints and toolkits to replicate those implementation models in others. So we're really excited about that. We're still selecting our sites. So if anybody's super jazzed about that and it works in a clinical site that provides prenatal care, please reach out, although we're honing in but have not made final decisions. So but we're really excited about that. And also we're going to be, as part of the project, we're going to be able to take the worksheets, the support planning tools, the value clarification tools, and digitize those and be able to build it, kind of rebuild the resource on a scalable platform that will be able to sort of serve up the content based on people's preferences and their values and so on. Was there a difference? I'm seeing a question. We'll take this one real quick. Were there any differences among the states with regard to licensing of different types of birthing providers? Does the website account for that? We talk about midwives in it and not nurse midwives or CPMs or whatever. So we didn't use sort of specific language, I would say, around midwifery. And we acknowledge, one of the videos is called "What Does Good Maternity Care Mean to You?" And that video talks about, midwives and birth centers and group prenatal care, but also kind of helps people like include some content in the video itself around like what to do if those things aren't available or aren't licensed and so on. So we tried to be as inclusive and mostly by being non-specific about those kinds of things. And then as far as reimbursable, some of the articles on the site address that, particularly around doula services, but we don't go into great depth around it. But let's see, I think there was one other. I think that's our last question. We are at 3:59, so at least here on the East Coast. Any final questions or final words from the other panelists?
Thank you. It was lovely to spend this time with you. Enjoy this resource for those who attended. It's a great resource.
And there's the website, everymothercounts.org/choices in childbirth. And please feel free to share it, use it, and be in touch if you want to talk about implementation or have feedback about it. Wonderful. Nice to see everyone.
Thanks so much. Good to see you all.